Well, welcome everybody. It's right about noon. This is Ralph DeLeon, and since Brian usually does our introductions, we didn't want him to introduce himself, so we're going to do a real brief introduction for Brian. Brian is with the Avio Insurance Group, and they focus really on the health insurance benefit issues that companies face. And this part of our webinar series is focused on that particular issue. Unfortunately, irregardless of your political affiliation or your political party, Brian is probably one of the only people I've ever met who has read the entire Affordable Care Act. So talk about somebody who knows what's going on in the document, and but frankly, presuming he slept a lot as well because it was good sleeping material. But that's why Brian's the expert and going to be talking about this. So Brian, I'll turn it over to you.
Thanks, Ralph. And we also have Deb King from DJK HR Consulting in the room. There will probably be some topics as we go through this webinar that Deb will have some thoughts about, but please feel free to ask questions of all three of us. Please note on the screen that if you haven't dialed in, that you do have to dial into your landline, and the number is on the bottom of the screen as you see it now. What we're going to talk about today is installing employer-sponsored health benefits, and we will, as Ralph mentioned, touch on pieces from the ACA or the Affordable Care Act or PPACA, whatever you want to call it these days, as we move through the material, because it will definitely impact how your installation goes and the choices that you make around plan design. So please feel free to ask any questions, and as a note, we are also recording this meeting, and we will probably have that out to all participants early next week. You'll be able to access it on our website and see the presentation and listen again in case you had a question or wanted to listen to an answer. So let's get started. Okay, one of the first things that you want to think about is your business strategy around offering employer-sponsored health benefits. Particularly, we're talking about major medical. There are other types of health benefits that you can offer that we refer to as ancillary, life insurances and so on, short-term disabilities. But, you know, the big nut for most employers is how do they get a major medical plan or a group health plan up and running? So the first question you want to ask yourself is, what's your reason for offering health benefits? Is it for the owners of the organization? Is it for the employees of the organization? And there's no right or wrong answer here. It's just, you know, what is the strategy and the reason for wanting to spend that money? Another common strategy when it comes to thinking about employees as your organization is growing is what's your attraction, your deployment, and retention strategy. And group health or offering benefits is part of your compensation strategy. It often when an employee comes to interview, one of the first questions we hear that's being asked to employers is, what benefits do you offer? So that speaks to, you know, what employee you're trying to attract, because usually a higher level employee or a higher skilled employee is looking for the benefits that come along, not only with remuneration in terms of dollars, but also in terms of benefits. Deployment is also an important factor to consider, because many studies out there show that a satisfied employee tends to perform at a higher level. And so they tend to deploy, your turnover tends to be lower, and your attendance tends to be better. Also, from an employer perspective, that if you have group health and somebody becomes sick, they tend to return to work quicker than as if they had no health insurance at all. And I think we all probably recognize that the cost of training and getting an employee up and running or acclimated to your values and your group or your organization can be just as much as the salary that you pay them. So that reflects in your cost of turnover as well. In other words, you don't want to bring an employee on and then also lose them to the competition because you don't have a healthy compensation strategy. Retention, and we kind of moved into that a little bit around what I just said, but group health benefits also speak to, you know, the fact that you want to retain that employee. In fact, we work with one group that's one of their main criteria for wanting to offer group health is that it takes an awful lot of money to get them up and trained because they are IT specialists. And once they get them trained, they don't want to lose that employee back to either an IBM or a larger organization. They want to retain them and grow the employee so that they reap the benefits of the education and experience that they've provided. So that's kind of your retention strategy.
So they're using employee benefit as a mechanism to convince an employee to stay in addition to training in the first place, then?
Yes, absolutely.
Okay.
Absolutely. In fact, again, coming back to my earlier statement, sometimes we hear employers saying that employees will tell them, well, the reason why I'm exiting or leaving is because company X is offering better benefits at the same compensation level that you're paying me now. So you have to go out and look at the market. The conversation that we had yesterday is, hey, we would like to actually do more for our employees, and one of the managers on the line said, but does the market demand it? And that's one of the pieces that you need to evaluate is, while I'd like to do more, does it make sense for me to do in my marketplace against my other competitors, and what are they offering as well? You also have a cost reduction strategy, and for those folks that are continuing to offer group health benefits, you also have to look at your costs, and so you can mitigate your costs by introducing wellness plans or by looking at different plan designs in the way of how much risk the employee takes versus the carrier takes. So while you have that ADR strategy, you also have to look at the business and financial reasons of how much I'm paying, and does it make sense for me to do that as well, because at the end of the day, my business still needs to have a good, strong P&L statement. So cost reduction I consider to kind of be the fourth factor that you need to look in terms of your strategy as to why I'm offering it. So how do we begin? Well, I mean, it's kind of that old adage, but you have to start early because it gives you that time to do the research, to understand what you're offering, to understand, as you see on the next bullet point, what your employees are looking for. It makes no sense to me as a business owner myself to offer something that employees don't like or don't need. That, to me, is the bottom line is, and that just becomes a waste of money. And maybe the employer at that point shouldn't have engaged in doing group health benefits at all. So you really want to ask your employees, hey, what kind of plan design are you looking at? That doesn't mean that, every employee is going to come back and say, I want a $5 copay or I want you to pay 100%. We find that most employees are reasonable and say, here's my expectation around what I'm looking for. And what you'll also find is that employees usually come back with a diverse set of criteria of what they're looking for, because even as we sit around this table here, the three of us have different financial circumstances which will dictate the type of health plan that may work for us or not work for us.
So when you your goal is to try to satisfy as many as possible, because you can never satisfy all, I'm going to presume, right?
Yeah, and that's a good point, Ralph, because today that's becoming less of a concern. It's still a concern because carriers are starting to open up the options, and we've all heard the word exchange out there relative to what the federal government has done under ACA, but carriers are starting to look at their own private exchanges so that one plan isn't the only option that you have to offer employees.
Oh, so offering multiple plans?
You might, yeah, you can do a multi-plan arrangement. And we'll kind of talk about that in a few slides, but that is one of the considerations that, and the criteria that you want to ask employees. And that will determine whether you should offer one plan design because you have a homogeneous group or a group that all thinks the same, or a group that needs multiple options. And trust me, there certain employers out there, you can get by with one plan and it works great. Other employees or other employers do have to offer maybe 2 or 3 plans in order to satisfy the needs of the group. And that comes back to that strategy. You have to do the evaluation and the research in order to understand that. And that's why you need to start early. So, this is self-serving, but, hey, you need to hire an agent to help you with plan design. An agent, is going to know the different carriers out there. They're going to know the different value propositions, as Ralph has just said around, hey, does a carrier offer multiple plan designs? We know that stuff. The other thing that the agent will help you do if you're a smaller employer is explain how that health insurance works to your employees. And you'll see what I mean by that in the next slide. Let's talk about plan design. We've actually started to talk about this a little bit, but your group size is important, especially in today's world. The ACA has changed the landscape of how a plan looks. And so the criteria there in today's world today, and the reason why I'm emphasizing that is because I'm sure by tomorrow it will change again, is that the demarcation line is at the 50 line, 50 employee size. Under 50, you have what's known as an ACA QHP plan. A qualified health plan is what QHP stands for. And an ACA qualified health plan has to meet certain metal values, and you may have seen that in the media in terms of meeting a bronze standard, a silver standard, a gold standard, or a platinum standard. The higher you go in the metal level, the richer the plan is, and the richer the plan, the more it generally costs. And I do say generally because you can have a platinum plan that sometimes does cost less than a gold plan, but it's still considered to be platinum based on how the plan is evaluated in terms of its actuarial value. Again, looking at these ACA QHP plans, you are community market rated. Many of you may be familiar with that. In the old world, you had composite rates, which meant that you had a rate for all employees that enrolled in self-only coverage. You had a rate for all employees that added a spouse. You had one rate for all employees that had children and another for family. That's done for under 50. You now have what's known as community market rating and member level rates, which means that every year your rate will change, and that individual member, based on their age, tobacco use, and location where they live, is assigned a rate. And that will change when they go from 21 to 22 to 23 and so on, all the way up until age 64. Touched on actuarial value and minimum value. Actuarial value is basically, to kind of keep it simple, is it has to pay out a minimum of 60% level of benefit. Don't confuse that with coinsurance. It is just basically overall based on the population of the state that you're in, that this plan compared to the population pays at least 60%. That's a bronze plan. A silver plan pays at least 70%. A gold plan pays 80%, and a platinum plan pays 90%. And it has to fit into those exact percentages, or the plan is not compliant. In other words, it can't pay 85%. It has to either pay 60, 70, 80, or 90 within a certain margin of error.
I hate to ask the question this way, but if that's the way it needs to be for employers that want to pay a little bit more, what do they just give employees a bonus for the difference, and they can decide how to use the money? Or
the actuarial value is actually based on the plan design, but the amount that the employer can pay is still a minimum of 50%.
Oh, okay.
And the employer can pay more than that if they wish. In fact, basically the legislation encourages it, especially in the over 50 group, because it becomes more affordable, which is actually my next bullet point. Thanks for the segue. Affordability is defined based on 3 safe harbors, at least for an employer group over 50. The 3 safe harbors that are used are your Box 1 W-2, the federal poverty line, which is, for argument's sake, is about $11,000. I think it's $11,500 for a single individual, and then roughly about $4,300 is added on for each additional dependent after that for the poverty line. And the last piece is basically your hourly wage to a cap of 130 hours a month. The affordability is calculated by taking the premium that the employee pays, the portion of the premium that the employee pays, and that can't be any greater than 9.5% of one of those safe harbors. So the employee can choose one of those safe harbors to measure their affordability. If it is not affordable to the employee, then they could qualify for a subsidy or tax credit at the exchange, or the health insurance marketplace as it's known now, And if it's not affordable, if the employer size is greater than 50, they could be subject to a penalty under the employer mandate under the ACA. And that amounts to, per employee, $3,000 per year or $250 per month. The penalty is only if that employee receives a tax credit or a subsidy at the exchange. So you could go forever, and if no employee doesn't go to the exchange and get a subsidy, you may not never know or ever receive a penalty notice. As of yet, I've had no employers that have received a notice, so I'm waiting for my first experience like you all are too. That's a little bit around ACA. The other difference that you're not seeing on my slide is that for an ACA QHP plan in small group, the rates are what the rates are. In other words, there's no health underwriting. For employers that are over 50, applications are still taken and health conditions are taken into account. For example, if you have somebody that is a diabetic in your group or that uses a specialty medication, prescription medication, or if there's heart disease in the group. They look at factors like obesity and height and weight tables in order to determine what the health premium is going to be. So very different. Under 50, the rate is the rate for that plan based on 3 factors: age, tobacco use, and location. That's known as community market rating. Over 50, it's still health underwrite it like it was in the old world. But you still have to meet certain criteria on that plan, like minimum value, essential health benefits, and then it's a qualified health plan with no preventive and no pre-existing conditions. Carrier selection. That was quite a bit on the ACA, so I hope I didn't overload you at that point. Carrier selection is also important, and Ralph touched on this earlier. Each carrier has a slightly different value proposition, and that can be different plan options and plan designs, and there's a vast difference now. A year ago, I would say that, the difference between a Blue Cross Blue Shield, as an example, and, say, United Healthcare, 2 well-known carriers out there, were probably minimal. Today, they can be vastly different in terms of plan design. United Healthcare, as an example, is one of those carriers that offers multiple plan choices. They call it their multi-employer plan option, where you can offer 3 or 4 plan designs to a small group under 50. Blue Cross Blue Shield, on the other hand, only offers dual option. Blue Cross Blue Shield doesn't offer any plans that have no copays. United Healthcare does. They have what's known as a coinsurance plan with a very low deductible, but it has no copays in it. That may be attractive for certain plan members who don't visit their primary physician or specialist that often, or at all throughout the year, and therefore it becomes a very cost-effective plan for them in terms of premium. Network is also important. There are some carriers that have a narrow network, and some carriers that have a very broad network. Again, if you've looked at United Healthcare, they are a very strong national carrier. So is Blue Cross Blue Shield, but they use their Blue Card program, which makes them more of a regional carrier versus a national player like United Healthcare. So if you were an employer that had employees in North Carolina, maybe as well as in Virginia or West Virginia, as an example, United Healthcare might be one of the employers that one of the carriers that you're looking at going to because they have limited restrictions.
And that's something you as an agent can help an employer evaluate what to do with that stuff.
Absolutely, because the licensing is different based on the plan in each one of the carriers for those. So to kind of get into a little bit more detail on that, Blue Cross Blue Shield says that, 2/3 of a certain percentage of your employee has to be based in the state where you are incorporated. United Healthcare says, hey, you can be in network all over the country, generally. It can be an important factor that a business looks at. The operating platform is also different as well. What I mean by operating platform is how claims are processed, what your employee experience is in going in and looking at their claims and their online experience and access they have to information on how their plan works, their benefit details, and so on. And there can be a vast difference between what you can see online and what information you have to access online, including providers, estimated cost by providers. And this is where Blue Cross Blue Shield you may look at as a differentiation. You can go in and you can use their cost estimator, and you could look at an outpatient facility versus a standalone facility and see the difference in the cost. And that may be important if you're on a plan design such as a high-deductible health plan supported by an HSA, where you're paying for the dollars until you meet your deductible. Most people want to maximize their HSA funds, make it go as long as possible. So being able to do that cost comparison on the carrier's website is very, very important. They're also starting to rate the quality of doctor as well. And just this morning I was having a meeting with a friend who was telling me about his father's knee surgery, and that he's now been in 4 times because of the reoccurrence of problems with his knee surgery. The carriers are starting to track that. So you can see, based on the physician, what the quality of services is, and one of the factors that they look at is how often is there a repeat of the surgery? How often is there problems with this particular physician or this particular maybe office, as an example. And while that shouldn't be your sole decision for making a choice to go with that particular physician, I think it's it's one of those indicators that we all look at when we're shopping.
So for those who are in the audience who work in medical practices, they may want to have a conversation with their physicians that now they're going to be rated. And so they may want to keep a little better notes, because if they ever have to do anything to explain why, somebody might ask.
They might, yeah. And I've had conversations with my own provider, and they've said back to me that the process of being designated a higher tier physician, there's multiple factors I've just described. One more from a healthcare perspective, but there are all multiple factors. I understand it's quite rigorous. So, to be a Tier 1 practice versus a Tier 2 practice, you really, I understand from the medical providers that's quite a rigorous process for them to go through. Occasionally I hear the kind of complaint, so to speak, that they go through it, but I think at the end of the day, some of the ones that I've talked to said it has helped them to be either a Tier 1 or, to be that Tier 1 provider, so to speak. And I'm sure there's different varying opinions on that as well. The other thing that we do need to look at and consider, and I don't consider them to be a carrier, although there are carriers, within the exchange, is what's known as the Small Business Health Insurance Options Program. You hear it out in the marketplace and the media as the SHOP. And it's the business side of the exchange. So an individual can go and purchase insurance at the exchange, but so can a business. Now, what are the differences? The main difference right now is if you're a smaller employer, you could possibly receive a tax credit of up to 50% of the premium that you pay on behalf of employees. Typically, owners and owners' families are excluded from that calculation. Usually that's due to, in most circumstances, the owner draws probably a higher salary than what most employees do. And so because the credit is based on a combination of number of employees and average salaries, it makes sense to exclude the owner's salary so that it doesn't push that average up. But it can be as high as 50% credit. The credit is reduced with higher average salaries and the number of employees. The SHOP also, I think it fits under certain circumstances, but one of the things that you want to look at is the number of plans that are available in the SHOP and the number of carriers that are available in the SHOP, so that you have a broad choice of selection that you can make. Because Blue Cross Blue Shield in North Carolina is one of the only carriers other than Coventry that's participating in the SHOP, they have limited plans available. So, again, that's one of the reasons why you want to look at inside the SHOP and outside the SHOP to see what best fits what strategy is you're trying to achieve.
And this is something you could do on an annual basis then?
Sure. Absolutely.
So for instance, for our clients, when they have an annual meeting, based on what you're just describing, I think we need to add, reevaluate your health insurance plan, for the next year as an item on our annual meeting checklist.
Yeah, in fact, one of the things we do as an agent, conversation I had with a client just prior to this is with a restaurant, and that is the process that we're going through right now, is reevaluating whether the existing plan meets their needs and what are their options going to be. So we'll probably, as we move towards the renewal date of November 1st, have a Plan A option, a Plan B option, and a Plan C option. And one of those options might be not offering coverage at all because of the size of employer they are.
Mm-hmm.
But I think that's a very valid strategy. Because we have some folks that are medical providers on the phone, the other piece that you want to look at is associations are also offering plan design. So in North Carolina, we have the North Carolina Medical Society that offers plans. And I think that's an option that you need to look at because there are the other benefits that may come along with that to be part of that association. The one caveat there is do be careful that an association is still considered for most cases, in most instances, to be a trust or a self-insured plan. And the liability to the employer, they should understand that if the association plan or self-funded plan is not running well, and I've experienced this on one of my groups, is that you do have liability for any shortfall in funds. I had a group here in North Carolina that actually moved their plan before the trust shut down, and we kind of see it coming because their membership was down and their claims were exceeding premiums coming in, which are two sort of indications that the trust isn't doing all that well. In this case, we were lucky that at the end of the day, once the trust was wound up or the self-funded plan was wound up, they received a check for about $500. But that was pretty close. It could have easily went the other way, and they could have been billed for $500 in order to cover the shortfall. So read your agreement is the best thing that I can say. I think that's what Ralph would say as well. That any contract you're entering into, read the contract so you understand your liability.
It's a form contract that they put together, and you're not going to be able to negotiate much of it, but there are some provisions that you might be able to have changed. So but it's also good to understand what it says.
Absolutely.
Mm-hmm.
When you're considering employee needs, I always think of insurance as folks are emotionally detached to it until they actually need it.
Okay.
And then it's a very emotional because they have a claim and they want to know, hey, how's my policy going to respond? What am I responsible for? What's my deductible? What's my copay? And that's usually when you start to see the anxiety build. Folks usually understand affordability, and they understand it's a financial instrument, but understand that you are transferring the risk of your health over to the insurance carrier. So what does that mean? That basically means that the more risk that you retain as the employee or the person that's purchasing the health insurance, it means that your premium is generally lower. Under the ACA, the difference in those deductibles or copays and the difference in the premium is a much narrower spread than it has been in the past. In fact, I have a very good friend who used to be on an HSA who learned that this year, that saw their premium go very high because a high deductible health plan used to be very cost effective in terms of premium because the member was accepting a higher deductible. That's not so true these days because the out-of-pocket maximum is capped at $6,350, and so no matter what the carrier does, they know that their risk is going to start at $6,350. Whereas in years gone by, we used to be able to do a high deductible health plan that had a maximum exposure of $10,000 with a nice coinsurance to help protect and share against that higher deductible, in the middle portion once the member met that initial deductible or out of pocket, if you want to call it that. So do remember that is a transfer of risk, and generally the higher the deductible, the less premium that you pay. Around employee needs, it seems to be that every employer that I talk to, 80% of the employers want their employees to understand their plan, but only 20% do. And my point there is that this is an investment. It's an investment of the employer's money and the employee's money. In fact, most employers I talk to generally pay much more than 50% of the plan premium, so you have a greater financial stake in it than often the employee does. As an employer, I want my folks to understand how their plan works because it's the benefit that I'm helping them fund. Which comes back to being self-serving because I think you need a good agent to sit down with your employees and describe how the health plan works.
Which also then helps in the retention and the recruitment, so it all fits together.
That's right. And, for me, generally, that's the most rewarding part of the job is because most employees do what they do well with their employer. That's where their skill set resides. So they don't understand anything usually about health insurance. Usually, they understand they have a plan, they have a deductible, but some of the nuances around it, just to sit down and have a 15-minute conversation on how it impacts the kids, or an aggregate deductible, or how the maximum out of pocket works, or prescription plan, just going over those details, you can kind of see that they get a big benefit out of that. Usually it's only a 10 to 15-minute conversation to help them understand and answer a few questions. Very worthwhile.
Can you do it in a group setting, or do you have to do it individually?
Normally I like to do it first in a group session, so I'll describe the overall plans and what the employer is offering and what the benefit. And then, because most folks don't like to say, hey, I have this, how would the plan respond? That's where it becomes individual. Particularly, they'll say, I'm on this medication. How will the plan respond to me? What copay will I pay, or what percentage will I get back, or when will I max out? Those sorts of things. And that tends to be more of a private individual conversation.
So that's really what the agent should be doing to help the employer out to do that. Okay.
Generally, yeah. Not all employees want it. Not all employers want to do it. We just think it's a good best practice.
Mm-hmm. Okay.
I'm looking at this and say, this is important. Why did I say that? And it's because Ralph said it earlier. I really don't think that any single plan is going to meet the needs of all employees. I find that sometimes that an employer chooses a plan based on cost only. And when we think about the marketplace that we all shop in, we don't always choose to purchase a product based on price only. Certainly it's a factor, but it's not the only factor. And otherwise, we wouldn't have a car called a BMW and a car called a Chevrolet. Not that there's anything wrong with those, it's just that we all have different buying preferences. And they have different features, and they have a different value proposition. Well, the same is true with insurance and insurance carriers, is that they all have a different value proposition. And for the employer, I think it's important for them to understand what their employees need and also balance that with what the employer requires in terms of the financials and what their strategy is, coming back to what Ralph said, that they're trying to achieve with that employee group. And again, that may be an attraction strategy, a retention strategy, or a deployment strategy. It depends where you are, possibly in your business life cycle or the age of the business. And there's nothing wrong to be different. You may be choosing to have an attraction strategy and offer a richer plan at the beginning and have a strategy to reduce the richness of that plan over a period of time to bring your costs back in line. But you have to have a strategy. We suggest doing an employee survey. It's a valuable tool. It can be done on paper. It can be done online, SurveyMonkey, those sorts of things. Or it can be done in a town hall meeting if, lots of employers are 5, 10, 15-person groups. They do monthly meetings. And sit down and have a discussion and say, here's some of the things we're looking at. Tell us what your thoughts are. And often what I find is that employees aren't necessarily thinking about themselves, but sometimes they're thinking about their family, their children, and their spouse and what they need as well. For the employer, practice the total rewards concept. While I think that most employees and people are becoming much more informed about the cost of health insurance, I think it's still a good practice that the employee says, here's your compensation, what you get paid on a monthly or an annual basis, but here's the things that you don't see in your paycheck. Here's the cost of your group health insurance. Here's the cost of the life insurance that we provide you. Here's the cost of the dental, because that's part of your total rewards. Here's the wellness program that we do. Often you'll hear that in HR circles, Deb, as kind of like the hidden paycheck, right?
Mm-hmm.
And I think it's part, employers will say to me, but why do I need to put this on the pay stub, or why do I need to do these things? It's more administration. It's because the more transparent you are, the more employees appreciate what you're doing for them in terms of the cost. As an average out there, benefits can be up to 30% of the actual compensation that an employer sees.
It's a good idea for the employees to see that.
Right. Agreed. So you want to practice the total rewards concept because it comes back to that strategy of deployment. If people feel that they're being valued and generally paid well, then they tend to work. I'm not going to say harder, but they generally tend to be more committed to the organization because they understand they're being valued in terms of what you offer them, and they're given choice. Okay, compliance. Yuck. But it's part of it. If you're going to offer benefits, there's many different pieces that we have to comply with, and some of them you should be aware of. HIPAA. I know that Deb does an audit, and part of her piece around the audit is whether you're HIPAA compliant. And really what that is you need to be careful in sharing information as the employer. You need to make sure that the applications for the group health has all their personal health information as well as their personal identification information is housed securely, and that only the HIPAA coordinator has access to that.
A lot of people take the application for the health plan and stick it in the employee's personnel file, which is something you shouldn't do. Anything that's medical should be kept out of the regular employee folder.
Agreed. The other piece associated with that folder is that often they sign up for life insurance and have a beneficiary designation.
Yes.
And then something happens, and the carrier comes back and says, hey, do you have that application that has the beneficiary designation? Because it's very important to have. You have to have the signed copy of it in order to follow through with the payment of the life insurance. So those things you want to keep in a secure place. State continuation in COBRA. While COBRA starts at an employer size of 21 and above,
20
and above.
20 and above. And then below that is state continuation.
Right. And state continuation often tracks the requirements of COBRA as well. I can't tell you how many phone calls I get that says, hey, do I have to do this and do I have to offer it to my employees even though I'm under 20?
I don't know. There's no law that says you have to do it with state continuation, but you really should. And there's letters that you can give your employees to tell them about state continuation. They have a new notice out for COBRA, which in the COBRA notice, it talks about the exchange. So when you give your employees information about state continuation, you should also be notifying them of the exchange.
Deb, when an employee signs up for group health or when an employee is hired and you are offering group health, are you supposed to give them a notice around COBRA at that time?
Yes, good question. When the employee first signs up for COBRA, you have to give them a letter. The letter is going to go to the employee, and you also, if the employee has covered dependents who don't live in the household, you have to make sure that you get that letter to all the covered dependents. Most people today have a third-party administrator who handles their COBRA, which is great. But please check with the person the people who administer your COBRA, because not every third-party administrator sends out the initial letter. Your plan may be set up that they just send upon a qualifying event. So check with your third-party administrator. Make sure that initial COBRA letter is going out.
Correct. Agreed.
And you don't need one for state continuation.
Agreed. Family Medical Leave Act. Again, I will often field calls around, do I need to continue to pay the group health care premium because I have somebody that's leaving on the Family Medical Leave Act? Often that's above my pay grade, to be honest, so I get somebody like Ralph or Deb involved to answer more of the legal questions. But Deb, my understanding is that the employer still has to continue to pay that group health premium, the portion that the employer pays.
Yes, if they're a company who needs to comply with FMLA now, but you also have to remember, just because the company is required to comply with FMLA doesn't mean that every employee is entitled to FMLA. They have to have an illness, an injury, an event that's covered under FMLA. The other thing is they've also had to have worked 1,250 hours. So just because the company is required to comply doesn't mean the employee is. And that's people really need to understand that whole piece better, and most companies that I deal with don't. But if you're an FMLA company and somebody falls outside of FMLA, then the company isn't responsible for their portion of their health benefits, and now it becomes a COBRA event.
Mm-hmm.
So you have to know, is it an FMLA event or is it a COBRA event? And then if it's a COBRA event, then you have to make sure that you initiate that, the election letter.
So the part that the employer has to be aware of is that first, do they qualify? Is it an FMLA event? Do they qualify or are eligible for?
And then have they met the hours?
Right. Agreed. The Affordable Care Act. It's a huge bullet, folks. There's no doubt about it. But you have multiple compliance notices on this piece, and one of them is coming up shortly here, which is your DOL notice to advise whether your plan meets minimum value or actuarial value, because that is the piece of paper that the employee will take to the exchange to say, here is what my employer offers. And that piece of paper may say, we don't offer any coverage, but you need to do it. And the reason why you need to do it is because the penalty is $100 per day per employee, up to a maximum of $36,500. Some significant penalties. Last year, you all probably read that it was waived. Multiple phone calls came in and said, well, if the penalty is not being applied, therefore I don't have to do it, right? No. You still want to do it because it's the right thing to do, and it's because it's been legislated in. And once you get into the routine of doing it, that prevents you from making a mistake in the future. So it's still something that you want to do. Some of the other notices, your summary benefits of coverage, if you haven't already experienced that started in September 23rd, 2013 for all plans renewing after that. All plans must be accompanied with, or an employee must receive it 30 days beforehand, or within 7 days of the actual renewal decision. That's $1,000 per event for not handing out your summary benefits of coverage. And that's that 8-page document that tells how the plan works in common, simple, everyday language, and that is the same document that UHC provides as Blue Cross Blue Shield as Coventry, so that the term and terminology is the same between different carriers. I actually do believe that that's a valuable piece that the ACA has introduced, because terminology that a carrier can use across its platform can be very confusing between maximum out-of-pocket, deductibles, aggregate deductibles, and when moving from carrier to carrier for an employer and an employee, those change in terms and definitions can cause you to misunderstand how your plan works. So I do think that's a valuable document to hand out to all your employees. It can be done either by email, as long as you meet the requirements of email, and that if the employee does say, hey, I want a printed copy, that you can deliver it to them within 7 days. There is no duplication required. If the carrier provides it, then you just have to hand out what the carrier provides to you.
And you don't have to ensure that the employee reads it. You just have to make sure that you give it out. And you should have records of when you gave it out so that when the challenge comes, irrespective of whether the employee reads it, who cares?
Correct.
The employers that needs to be protected.
We are also recommending for the Affordable Care Act grandfathering as another important status that you want to assess whether your plan meets or not meets, and there is a notice to hand out around grandfathering status as well. And that is also at the time that you do your plan renewal, and if you determine that your plan meets grandfathering status, which basically means that your plan was in place before the beginning of the Act, March 10th, 2010, I believe, was the official date. Don't quote me on the day, but I do know it was March. And if your plan was in existence and no changes were made to that plan afterwards, then you may have a grandfathered plan. That's important because you may not have to comply with your maximum out of pockets because you can maintain that plan, which could have a significant impact to you as an employer because your cost may be reduced. But you do have to hand out that notice to employees that say you believe you have a grandfathered plan. I've just discussed a few notices around the Affordable Care Act. There are other notices that you have to provide as well. One of the things that we do as a benefit of you attending the webinar is we give you access to an HR 360 library, and there is a section on healthcare reform in there, and you can go in and pull down a calendar of notices that are required to be given out and when they are given out, and it'll actually give you a link to the appropriate site, the IRS site or the Department of Labor site for a template of that particular notice. So I encourage you to go in and take a look at that. All fully insured plans have to meet with ERISA, and this is a bear of a piece of legislation, so I'm not even going to be kind to attempt to describe all the different pieces of what it affects, but we tend to think of it that it only applies to 401k. It also applies to group health care plans, folks. So, I mean, it can affect you from discrimination issues to payment issues to trust and fiduciary responsibilities. You want to be aware of it. Where we find folks get most in trouble around ERISA is typically how they share the premium with different employees in the group. And before we used to be allowed to be able to kind of class out employees, generally for a small group, anything that's under 100, it's pretty hard to class out these days and say that I'm going to pay a different amount for this group of employees than this group of employees because it comes back to that affordability issue under the ACA. So my point here is really to be aware that if you have a fully insured plan, you have an ERISA-based plan as well.
And you need a summary plan description, correct, which is different from your summary of benefits coverage.
Right. Right. In fact, if you were ever audited by the DOL or by any government agency, the first thing they're going to say is, and ask for is, do you have your summary plan description? The first document they're going to ask you for, and if you don't have it, you might need Ralph.
You will need Ralph.
Other pieces that around compliance, the Internal Revenue Service regulates health reimbursement accounts as well as health savings accounts on how you structure contributions to those accounts and also how they work in terms of funding arrangements and what is a qualified medical expense, third-party adjudicators for HRA. I run into employers that say, oh, we just pay it out ourselves. IRS says you have to have a third-party adjudicator that qualifies the expense and pays it out. So you want to be careful of those things. It can get you into hot water. In fact, I have an employer that did get into hot water around that, and they are now using a third-party adjudicator for their HRA. It was a painful lesson, but I think one that was worthwhile because they were taking pity on, at least by the IRS in this case. Your Department of Insurance, which is at your state level, often provides additional regulation and also different parameters around your health insurance policies and regulate the companies that are in state. In fact, here in North Carolina, before any rate increases are approved, the DOI looks at those and says, yep, we're going to allow them to go through, and they really do have to be justified these days. Now, they look at it not on an individual policy basis, but look at it on an aggregate basis, more so. They also approve plan designs. Go ahead, Deb.
Oh, I just wanted to add, for those of you who have employees in other states, what the Department of Insurance dictates may be different than from here in North Carolina. So you really need to know what's going on
yes.
In other states. Like, for example, a state like New York or New Jersey has state-funded disability, which is different from what we have here. So you really need to know what's going on in the other states.
In fact, we talked about state continuation earlier, and a good example is Texas. Texas says that if your COBRA benefits run out under state continuation, you have to provide an additional 9 months of benefit for access to that plan under state continuation. And that's governed by the State Department of Insurance.
And now there's certain states that even if you're not an FMLA company, you have less than 50 employees. Certain states like such as New Jersey have state FMLA insurance, which is similar to a disability. So you may not necessarily be an FMLA company, but your state may offer FMLA insurance, such as a disability.
Yeah, absolutely. So this slide's intention is to kind of help you understand the different government agencies and the different pieces of legislation. We touched a little bit on notices and reporting. You really kind of want to get a handle and get organized around what those notices are, create some sort of diary or a tickler system of some sort that you don't forget about them. One of the things that we do is often you'll see it come out in the newsletter that there's an indicator or a reminder around this notice is due, especially if it is something that applies to all group health plans as opposed to something that is triggered at your renewal date. Deb touched on summary plan description. All plans, regardless of employer size, are required to have a summary plan description, and it should cover things like, who's the plan administrator, how do I get in contact, what
COBRA rates are in there.
Correct. In addition to how much is the employee share of the premium, what does my plan cover, in general terms, how does it work in terms of deductible. So it is a fairly robust document.
You really want to have that completed. I mean, if for any reason your company is being audited, where they're going to send the notice and who receives that notice is outlined in the summary plan description. So you don't want some lowly person in your accounting department getting a notice that your benefits plan is being audited.
Right. You also want to document your offer of coverage and eligibility, and that's based on hours of service, not hours of work, hours of service. Hours of service means that vacation time, FMLA time, military leave, disability time are all included in hours of service. There is a good definition on the IRS website of what hours of service it is, because it's just not that they work 30 hours per week. And so we need to kind of build that into our language to make sure that we understand that we also have to include the other benefits that we provide if it's paid service. You also want to document who you've offered coverage to, and the best way to do that is through the application. So every year I recommend to my employers that they have the employee fill out the application, and you know whether they've declined it or whether they're eligible for it.
And make sure they sign a waiver if they're going to decline.
Good advice, Deb. Waiting periods, this is kind of a simple one. No longer, they can't be in excess of 90 days is the general rule. You can have waiting periods less than 90 days, 30, 60, and so on. Also, don't confuse the administrative period under the employer mandate with the waiting period. That administrative period under the employer mandate for large group is only so you can determine whether you should offer coverage to that employee. So that we found some confusion around that. I won't go into great detail on that because that topic is particularly large under the employer mandate, and we probably don't have time in the 8 minutes that are left. You want to be aware of discrimination. This is something that I encounter, and that goes back to who you offer coverage to. make sure that you are compliant and that the golden rule in benefits is what you do for one group of employees, you should do for another group of employers, and also category of coverage. So if you offer to pay 100% of family coverage to one employee, theoretically you have to do it for all employees that elect to have family coverage. So please be aware of that. It only takes one phone call, Ralph.
Only one.
To create a problem.
And it's usually that disgruntled employee for whatever reason. They didn't, something came up that they didn't like, and then they just fire off, and all of a sudden they have lots of things they don't like.
I have penalties here only because I just wanted to mention that I get the sense that from government agencies there are some leniency around the penalties as it comes to as it applies to the ACA. But I wouldn't take that for granted. I know there's some things that they've said, particularly around the transition rules, that they will not waive the penalties. And they are making you now sign certifications under certain instances that you do qualify for transition rules. And basically that means that if you want to retain your existing plan design for another year, that you meet these requirements. And if you don't have an agent, you probably should discuss what that criteria is with your agent. Installation usually consists of, and we sort of touched on this, an open enrollment period. Usually that can be 30 to 60 days. Sometimes it's 30 days before and 30 days after so that you capture everybody. There's generally a group meeting, usually individual employee meetings after that, or at least some supporting materials that are handed out on how the plan works. This is a great time to make sure you have all those notices. So when you do your renewal, I call it an onboarding package, and that onboarding package can either be used for existing employers or for new employees that are coming in so that you make sure that all the notices you're required to hand out are placed in that package. To Ralph's point, I see a lot of employers have the employer sign off when they come in saying, I received my onboarding package, and that that material is in there and that they've received it to help protect you against somebody saying, I didn't get it.
Develop a standard operating procedure and don't deviate from it.
Yes.
Because it's much easier to convince a court or an administrative agency that this is what we do with every employee that comes in.
Communication strategy is important as well because your group benefits are only as valuable, or any benefit that you're providing is only as valuable as how you communicate what that benefit is or what it does for you. And sometimes, I used to have a person I worked with that said that you can't communicate just one time. You have to communicate at least 250 times before the person actually hears you. These days, I do believe that's true because we have so many pieces of correspondence coming at us, whether it's email, voicemail, text, just to name a few. So you do have to keep repeating yourself. But I think Ralph made a valuable point is that communicate it generally the same way so that you're not creating confusion. Post-installation. Please that as even if you're changing a plan that you're moving from one carrier to another as an existing employer or you're introducing a new plan, check your bill. Carriers make mistakes. I had one group, a few years back, say, hey, you forgot to install our vision plan, and yet the vision plan didn't show on their invoice for over 2 years. Now, they didn't have to pay for it, but what created a mess for them is that they were charging employees for it. And so now that creates a problem with ERISA because you've charged them for a benefit you're not that you haven't provided, in essence. So, technically you have to go back and refund them all. Mm-hmm. So check your bill. When you get it, do your audit, make sure everything is correct. Make sure your employer roster matches those that have enrolled so that there's nobody missing. Make sure all your plans are installed. I know it seems kind of silly to look at that, but you got to go back and check and make sure that what you asked for is what you got. And it's just good, best business practice. Check to make sure your payroll deductions are accurate. Even in our own agency, I found that sometimes, on our payroll, we've missed to updating what the employee share is. And because either the plan design has changed and the employee share may go up or go down, I've gone back and looked at payroll and found that, the amounts are wrong. Now, that's going to be even more important in the future because you're probably going to be using your payroll to report under the ACA what the different plans and payments are and percentages are that you have to report into either the IRS or different government bodies, which again is a whole other conversation. I do have a question that says, will you repeat the penalties, please? For certain notices, the general ACA penalty is $100 per day per employee to a maximum of $36,500. I think the other one that I quoted was the summary of benefits of coverage. That is a $1,000 fine per incident. So if I have 3 employees and I don't provide it to those 3 employees, it's $3,000. My understanding of the way that the penalty works. Certainly there are other penalties that can be assessed, but generally that ACA broad penalty is that $100 per day. I expect, like everything else, as we get rolling with this, they will probably differentiate those. I'm sorry, I don't think I covered all the points. You want to make sure this when I find an employer does a high deductible health plan, I find that they forget about this piece here. And actually doing the health savings account. I have one employer in the January that set up a high deductible health plan but forgot to set up the HSA. So again, that comes back to your post-installation routine. Ongoing. You need to do test reporting, which is your FTE count, and your enrollment triggers. Do remember that if you offer group health care and you forget to enroll somebody, and it's your fault as the employer, you could possibly be liable for not enrolling them, and therefore the sickness that has occurred or the accident that's occurred under the group health policy. And in fact, in the commercial world, carriers are now starting to offer what's called group benefits liability for these very instances where the mistake is made on enrollment.
It's not very expensive. I mean, I don't think it's any more than $200. I always recommend all my clients make sure that it's included in their insurance package.
Yeah. Deb said earlier that ensure the applications are filed in the employee HR folder, and what she means by that is like make sure it's in a separate pocket of some sort, but not with all the general correspondence and general information.
You don't want any type of health information in the regular employment folder. All that has to be kept separate and locked.
Under key. And make sure you limit access to it. Ongoing throughout the year, listen for employee feedback. Those are going to be your triggers as to what you're going to do at your next renewal date. You'll get a sense of whether the plan design is too rich, too skinny, or how you might need to change how much you share in premium.
Those sort of questions should be part of your exit interview. That's a very good time to get information from people about what they really think. In the exit interview, or during the year, you can do an employee satisfaction survey.
Yep. And if you have a good relationship, we used to do it in a smaller organization right during the performance review. And it wasn't necessarily that I would ask you up front. I would hand you a piece of paper and say, look, fill this out. At your leisure, hand it back to us. So we kind of get a sense. You don't have to sign it or anything like that. So I may not know who it's coming back from. It comes back into my mailbox, but it's an opportunity to do it at that
I do want to warn people about something with that. You'd be surprised at some of the ridiculous feedback you get back. I remember one year we did an employee satisfaction survey, and people put in, they wanted on-site child care. And you're talking about a company with 50 people. And they're asking for on-site child care. And believe it or not, we had several people put down that they would like to have a spa day.
But those things also provide an opportunity to put certain costs and expenses in context against the size of the employer that you're dealing with. So even though that seems ridiculous, it gives you an opportunity to discuss it and say, here's the reasons why that's not effective for us. And we would rather do these other benefits than have that cost for maybe just 1 or 2 employees, that we can improve the whole employee experience. Deb kind of touched on this, review plan operation and impact of wellness to manage future premiums. That's important. You want to encourage wellness in the group because it will help you with future premiums as well. And certain carriers have different online wellness programs that you want to get employees to enroll in. In fact, and just to mention one, I mentioned that small group is rated on tobacco. A lot of the carriers now are saying that if the employee enrolls in their online smoking cessation program, they'll waive the 20% increase in premium, and they can do that online, and that's part of your wellness strategy. Anything that you can do there helps the employer manage their future cost. Okay, we went through that last piece, but this is me. Of course, there's two other people in the room as well, but I'm self-serving, as you can see. Please feel free to reach out. That's our work number, but you also, through our invitation, have our emails. I think you know probably each one of us individual. Please feel free to reach out with questions. Anything that we can do to help. And again, we will also have this available in recording format in the next couple of days. This is our disclaimer. We couldn't sit in the room with Ralph being an attorney and not say, hey, we can't address every possible situation or every piece of legislation, law, or regulation that this impacts. It's really meant to make you aware of certain risks and exposures and help you reduce or assess your liabilities. We want to make sure it's not legal advice, that you understand that, or meant to represent legal advice. There are certain pieces here that we feel strongly that if you have concerns around how you're sharing premiums and so on, or how your group health plan is designed and structured, that you really need to have the help of a good employment law attorney to help you sort those things out. If any of you are in the area, we are hosting a workshop on June 26th dedicated to the ACA. It's 3 hours. It's guaranteed to hurt your head. It's on our website, and you will see that when we send out the notice probably early next week. But you can find it on BYOL-Employer.com, and it's under the event section. Anything else, Ralph?
I think we're probably good.
I apologize. We're 5 minutes over, but please do reach out with any questions, and thank you all for attending today.